Did you know that doctors can instantly spot serious health issues just by observing certain hygiene mistakes in their older patients? These seemingly harmless habits could actually be silent warnings of dangerous conditions developing in your body right now. What's truly alarming is that most seniors have no idea they're making these critical errors every single day. In the next few minutes, I'll reveal 7 personal hygiene mistakes doctors immediately notice in their elderly patients, and how fixing them could literally save your life or the life of someone you love. This information isn't taught in schools, rarely discussed in doctors' offices, and almost never mentioned in health magazines. Yet, it could be the difference between enjoying your golden years in good health or suffering from preventable conditions that rob you of your independence and dignity. Let me tell you about Harold, a 75-year-old retired engineer who believed his personal care routine was perfectly fine. He was active, played golf twice a week, and never missed his grandchildren's baseball games. But during what he thought was a routine checkup, his doctor spotted 3 major hygiene red flags, each revealing that Harold had been developing a serious health issue for months without having a clue. "I had no idea," Harold later said. "I thought I was taking good care of myself. If my doctor hadn't noticed those minor hygiene issues, I might not be here today." Today, I'll show you exactly what those mistakes were, so you can avoid Harold's frightening experience. More importantly, I'll share the simple, life-saving changes you can make starting today. Let's begin. Mistake 1. Neglecting oral hygiene. When was the last time you really looked at your toothbrush? Is it frayed or worn out? Are you brushing thoroughly? Twice a day? Every day? Now here's the bigger question. Did you know poor dental care isn't just about bad breath or tooth loss? It's directly linked to serious issues like heart disease, stroke, and even dementia. Geriatric specialists at Harvard Medical School have found that bacteria from gum disease can enter the bloodstream, causing life-threatening inflammation in the heart and other organs. In fact, their research shows that seniors with poor oral hygiene are up to 3 times more likely to develop cardiovascular conditions. Let me tell you about Sylvia, a 68-year-old retired schoolteacher from Oregon. She ignored her bleeding gums for months, thinking it was normal for her age. "I figured that's just what happens when you get older," she said. But during a routine physical, her cardiologist found serious inflammation in her heart valves, directly caused by bacteria from her mouth. He told her that if she had waited just a few more months, the damage might have been irreversible. So what should you do right now? First, check your toothbrush. If it's more than 3 months old, replace it. Ideally, use an electric toothbrush, which removes over 60% more plaque than manual ones, according to researchers at the University of Pennsylvania. Brush twice a day for a full 2 minutes. Set a timer if you need to. And never ever skip flossing at night. Also, keep up with regular dental checkups, even if you have dentures. Have you noticed bleeding while brushing? Gum swelling? These aren't normal signs of aging. They're your body trying to tell you something's wrong. Don't wait. Act today. Mistake 2. Infrequent bathing and skincare. Be honest with yourself. How often are you really bathing? As we age, many of us bathe less often. But here's the danger. Your skin is the largest organ in your body, and changes in its condition can reveal serious internal problems before any other symptoms appear. Dermatologists at the Mayo Clinic warn that seniors who bathe infrequently often miss early signs of diabetes, liver dysfunction, and even cardiac issues. Their studies found that up to 40% of undiagnosed medical conditions in elderly patients could have been caught earlier through simple skin observation. Take Clarence, a 77-year-old retired postal worker from Michigan. He thought bathing once a week was fine, especially in winter. "I didn't want to dry my skin out," he said. But when his doctor noticed discoloration on his legs during an unrelated exam, further testing revealed early-stage kidney disease. The discoloration wasn't caused by poor hygiene, but the lack of regular bathing had masked a serious symptom. So what's the solution? Set a routine. Bathe at least 3 times per week, even if you're not active. Use a mild, fragrance-free soap that won't strip your skin's oils. After your bath, apply moisturizer while your skin is still slightly damp. This locks in hydration. Most importantly, examine your skin regularly. Are you noticing dry patches? Itchy spots that don't go away? Areas that are darker or discolored? These may be warning signs. Don't ignore them. Don't wait another week. Mistake 3. Ignoring nail care. Take a quick look at your nails right now. Are they clean, trimmed neatly, free of discoloration or thick patches? If not, you might be missing one of your body's loudest warning signs. Your nails are more than just cosmetic. They're a direct reflection of your internal health. That's why doctors, especially geriatric specialists, check them first. According to the American Academy of Dermatology, nail abnormalities can signal over 20 different systemic conditions: anemia, thyroid disorders, circulatory problems, even heart disease. Their studies show that in adults over 65, nearly 30% of previously undiagnosed conditions were first detected through nail changes. Let's talk about Beatrice, 82 years old. Her toenails had thickened and turned yellow. She stopped wearing sandals and figured it was just old age. But when foot pain became too much to ignore, she finally saw a podiatrist. The verdict? A fungal infection, left untreated so long that it revealed a suppressed immune system. Further tests uncovered a serious underlying condition requiring immediate attention. Beatrice had no idea. So what should you do? Trim your nails regularly, straight across with slightly rounded corners. This prevents painful ingrown nails. Keep your nails clean and dry. Change your socks daily. Wear breathable shoes. But most importantly, don't ignore changes. Are your nails brittle, thickened, discolored? Those aren't harmless signs of aging. They're your body whispering a warning. Will you listen before it's too late? Mistake 4. Improper incontinence management. This is one of the most hidden yet dangerous hygiene mistakes affecting seniors today. Over half of older adults silently struggle with incontinence. But instead of getting help, many try to cover it up out of embarrassment. Doctors at Johns Hopkins have found that untreated incontinence isn't just inconvenient. It leads to skin infections, falls, and can even hide serious conditions like bladder cancer or prostate issues. In fact, their research shows that seniors who properly manage incontinence have 60% fewer complications than those who don't. Let me tell you about Douglas, age 73. A retired accountant from Arizona, he noticed occasional leakage. But instead of speaking up, he used paper towels and changed clothes often. He thought he was managing it. But when painful sores appeared, he finally went to the doctor and discovered he had advanced prostate issues that could have been treated months earlier with far better results. Douglas later admitted, "My pride nearly cost me my life." So here's what you need to do. If you're experiencing any signs of leakage, talk to your doctor immediately. This isn't shameful, it's extremely common and treatable. Use high-quality incontinence products designed for comfort and safety. Avoid DIY solutions like paper towels or toilet paper. Change promptly when wet. Follow a proper cleansing routine to avoid rashes or skin breakdown. And above all, understand this. Incontinence is not just a normal part of aging. It's a signal, and one that deserves medical attention. Hiding it won't help. Addressing it could protect your skin, your dignity, and your life. Mistake 5. Dangerous ear cleaning habits. Let's be honest. How do you clean your ears? If you're still using cotton swabs and pushing them deep into your ear canal, you're not cleaning. You're risking permanent damage. Many older adults make this mistake daily, thinking they're removing wax, when in fact, they're packing it deeper or even injuring the delicate inner ear. ENT specialists, ear, nose, and throat doctors, report that improper ear cleaning accounts for nearly 40% of ear canal injuries in patients over age 65. Let me tell you about Patricia, 71, a retired librarian from Washington. She had cleaned her ears the same way for decades, with cotton swabs, until one day she punctured her eardrum. The result? A painful infection that spread to nearby tissue and caused permanent hearing loss. Her words were heartbreaking. "I thought I was being hygienic. No one ever told me I was doing it wrong." So here's the safe way to care for your ears. Never insert anything smaller than your elbow into your ear canal. Clean only the outer ear with a warm, damp cloth. If you feel there's excess wax, use eardrops made specifically to soften wax buildup, and follow the instructions exactly. But more importantly, see a doctor if you're experiencing any of the following: pain discharge, hearing loss, a feeling of fullness or pressure. Do not try to remove the wax or fix the issue yourself. You could make it far worse. Your hearing is precious. Protect it with the right care. Mistake 6. Poor foot hygiene can be a silent killer. When was the last time you examined your feet carefully? Not just a glance, but a true inspection of the soles, the heels, and between the toes? For seniors, foot hygiene is about far more than just keeping things clean. Doctors often examine the feet first because they reveal critical signs of larger health issues like diabetes, neuropathy, and circulatory problems. According to the American Podiatric Medical Association, up to 85% of diabetes-related amputations in seniors could be prevented with simple, regular foot care. Yes, 85%. Take Raymond, 76, a retired factory worker from Illinois. He brushed off the dry patches and small cuts on his feet for years, thinking they were just part of getting older. But during a routine exam, his doctor spotted discoloration and numbness, both early signs of diabetes. With quick testing, they caught the disease in its early stages, when lifestyle changes could still help. "If my doctor hadn't looked at my feet," Raymond said, "I might not have known for years, and by then, the damage could have been permanent." So what should you do? Start with daily washing and drying, especially between the toes. Moisture in that area is a breeding ground for fungus. Wear clean, dry socks, preferably cotton or moisture wicking. Check your feet regularly for sores that won't heal, discoloration, unusual swelling or temperature differences, numbness or tingling. Moisturize the dry areas, but never apply lotion between the toes. And never ignore pain, odd sensations, or wounds that aren't healing. If something doesn't look or feel right, see a medical professional immediately. Your feet carry you through life. Keep them healthy, and they might just help you detect something far more serious before it's too late. Mistake 7. Ignoring hygiene changes caused by medications. Are you currently taking multiple medications? Have you recently noticed a change in body odor, increased sweating, or mouth dryness since starting one of them? Here's what most seniors don't know. Your medications might be the hidden cause of some serious hygiene changes, and these changes could be warning signs of something far more dangerous. Pharmacologists at the American Geriatric Society have documented how certain medications can trigger internal imbalances long before more serious symptoms appear. These include excessive sweating, new or unusual body odor, persistent dry mouth, changes in skin appearance. These hygiene shifts aren't just uncomfortable. They may indicate toxicity or harmful drug interactions that require immediate medical attention. Let me share the story of Barbara, a 67-year-old retired nurse from Florida. Barbara's family kept commenting on a strange smell they assumed was from poor hygiene. But Barbara was showering daily and using deodorant regularly. Still, the odor persisted. When she finally saw her geriatrician, he recognized the issue instantly. It was not external. It was a sign of internal toxicity from a new prescription that was slowly damaging her liver. "I thought I was doing everything right," Barbara said. "I never imagined the problem was coming from inside me." So what should you do? Keep a simple hygiene journal when you start a new medication. Track things like sweating patterns, body odor, mouth dryness, skin changes. Stay hydrated, unless your doctor advises otherwise. If you notice sudden changes, do not dismiss them as aging. Report them to your doctor immediately. And never change medication doses on your own, even if you're convinced a side effect is bothering you. Let your doctor evaluate whether a different dose or medication would be safer and more effective. Your medications are meant to help you, not harm you quietly. Listening to your body, especially the hygiene signals it sends, can make the difference between early intervention and serious long-term damage. Now, you know the 7 personal hygiene mistakes that doctors instantly recognize in older adults, and more importantly, what they often reveal about your health. By fixing these small but powerful habits, you could prevent major medical issues, preserve your independence, and possibly add years to your life. Let's quickly recap. Neglecting oral hygiene, which can lead to heart disease and dementia. Infrequent bathing, hiding early signs of kidney or liver trouble. Ignoring nail care, concealing immune issues or systemic diseases. Improper incontinence management, leading to infections and missed cancer warnings. Damaging ear cleaning habits, risking permanent hearing loss or deep infections. Overlooking foot care, missing early diabetes and circulatory problems. Medication-related hygiene changes, signaling internal toxicity or side effects. Remember, hygiene isn't just about being clean. It's your body's first line of defense, and sometimes its only way to tell you that something's wrong. If you found this information valuable, please click the like button now. It truly helps us reach more people who need these life-saving insights. Has your doctor ever pointed out a hygiene issue that turned out to be more serious? Share your story in the comments below. Your experience might help someone else take action in time. And don't forget to subscribe and hit the notification bell so you never miss another powerful health video like this one. Please share this video with your loved ones, especially anyone over 60. This knowledge might not just improve their life, it could save it. Thanks so much for watching and take care of yourself. We'll see you in the next one.